Oh, sorry, it was on when I started. Apologies. It's a pleasure and an honour to be here today and to learn from you, so many of you people working in the field, and I look forward to the reflections tomorrow as well. I am here speaking primarily drawing on research that I've done at the University of Oxford. I'm a senior researcher at the Ethox Centre there and have also worked with the malaria gen study prior to previous work looking at international research ethics. And 8 minutes or 7 minutes 35 is a short amount of time to reflect on 4 very interesting principles. So I'm going to pick my targets a little bit and we can pick up other matters in the discussion. To provide one of the main backgrounds to inform what I will be speaking about is the work at Malaria Gen, where we were looking here. It's slightly different because it was focusing on genome-wide association studies, but it was some of the first research done looking primarily drawing on populations in Africa and Asia, and there we were looking at malaria immunity and recruiting young children, particularly 0 to 5 with severe malaria and contrasting controls and family groups. And we have in that paper, we discuss the process and the consultative process that we use to develop a data sharing policy and the framework. And it's number 2 on your section. It's a controlled data access policy. And underneath that, I've listed a couple of papers which discuss some of the issues that we looked at in more detail, both the process of enrolling participants and the ethical issues. And that study, funded by Gates and the Wellcome Trust, had an embedded ethics team addressing issues as they arose in the research. The second point that may be useful is a current study that commissioned and funded by the Wellcome Trust, where we're very conscious that a lot of the empirical data about stakeholder and particularly participants' approaches to data sharing are out of North America. You guys are doing great research, but we have very limited empirical data from a lot of low and middle income settings. And this study is aiming to start looking at some of those attitudes, and we're very aware from the Malaria Gen study that some of the attitudes in lower and middle income settings can differ in ethically significant ways that should be taken account of in a data sharing process. So this is currently data is being collected in this study. We have an analysis meeting in July, and unhelpfully, in terms of timing for you, we'll be reporting around December. Sorry. So it will be very interesting to keep an eye on how these projects are going. But there we're seeking to solicit what might be views about what is good data sharing practice and how might it be managed. So to come to your the principles in your excellent discussion document, the one I want to focus on most is the respect for the individual participant whose data are shared and take some of the reflections from the work that we've done. When seeking consent to data sharing, we had traditionally in the literature, we had these views from specific consent is always required through to a perspective that perhaps broad consent is appropriate. And then in the middle, we're starting to get these technology-mediated, very interesting approaches, these kind of granulated approaches to consent, dynamic consent, category consent. And here participants are not being asked to choose between specific and broad, but they can engage with, they can choose particular studies, categories of research or approaches that they want to be involved in. And the point that I want to make about that is that these intermediary processes are often very heavily reliant on technology, internet portals and other platforms. And in the context that we're working with in Africa and Asia, these are not available to the vast majority of participants. And so the tension again almost starts coming back to that harder point. What is the consent at the beginning of the study? What information do we need to provide, and what kind of things will participants be happy with a broader style of consent, even leading perhaps to open access, or if they want to limit it, in what ways might they want to limit it? And one of the things that our research is doing is looking particularly at how we might draw up some of these lines, what some of these categories might be. And I'm calling them tipping points. And one of those are the kinds of data to be shared. So in a malaria study, for example, you can see a lot of interest in sharing data about malaria gen. This causes a large amount of morbidity and mortality in the under 5s. People want to see this being addressed. They're very happy to share the malaria data, but they at the same time have a considerable amount of concern about sharing the HIV test results that were incorporated as part of the study. So might people see different parts of the data collected for a clinical trial differently? Be happy to share some of them, but not others. The location in which data is shared, and there are very interesting views, again, very varying views. So, for example, sometimes you will want to see data shared along perhaps religious lines. You're happy to share it with other Muslim or Christian populations, but not to cross over. Sometimes your further neighbours in North America or the UK are seen as a safe portal with great protections for data sharing, and other participants think that that data is going too far away. There's no longer the control, the empathy with the population. They want to see the data staying close to home. So how might we look at where the data is being shared? And we've had a very interesting discussion in this previous session about setup costs and marginal costs. And if people are not wanting to export data, what might be the costs of setting up hubs or portals within their context so the data doesn't all have to go overseas to establish portals? Questions also arise about who is accessing the data. And we have here some of the traditional concerns about commercial as opposed to academic enterprises. And then finally, the purpose for which data is accessed. And this can be differentiated from who's accessing the data. So, for example, in an epidemiological study in a very resource-poor setting, there's a lot of concern that either local government officials or pressure groups will get access to this data and be able to analyse it for purposes to fund particular agendas about the resources available to this population. So while academic research might be acceptable, research by other practitioners might be very concerning. So that is to provide a little bit of a framework of issues that we are looking at if you're trying to look at categories before a study begins, where those lines might be drawn. There's also the role of the trusted intermediary. We are recently at the Forum for East Asian and Pacific Ethics Committees in November, and talking there on a panel with industry talking about upcoming clinical data sharing. And there was a considerable amount of concern expressed by ethics committees that these applications are coming in and the framework that they should be using to make decisions both for prospective and retrospective applications. And so the value that would be seen in a methodology or framework to help inform case-by-case decisions in which data sharing is relevant. And also the attitudes in many contexts about using custodianship and guardianship and moving away from these ideas of ownership and rights and responsibilities, and that data is not necessarily given, it is lent to a project, but that the participants or the community who gave the data retain ownership of it, and members of that community are expected to act as guardians or custodians and have an ongoing responsibility about how that data be used, and so how these kinds of approaches can be taken into account. A final point on this issue is regarding consent to data being required as a condition of enrolment, and where you have a study in a setting where the study is seen to be very beneficial, whether or not it is appropriate to require that participants agree to data sharing when they may feel they have no option. They don't want to share their data, but the trial is considered valuable so much that they will accept data sharing even if it's not wished. And then finally, as we focus on the respect for the individual participants, just also what respect might be owed to communities and other stakeholders in the process. And we touch on that in some of the other principles. I do have short notes on the other principles, but not time to cover them, so we can perhaps return to them in discussion if appropriate. Thank you.